Okay, welcome to today's webinar. My name is Dr. David Kunashko. I'm the Medical and Innovation Director here at BIOFLEX Laser Therapy. We are a low-level laser therapy, red light therapy, you might say, or more properly, scientifically, photobiomodulation therapy medical device company. And we've been in this business for about 40 years. In fact, we are the original manufacturer of this type of equipment in North America. So today's title is 10 tips to achieve optimal results with your BIOFLEX Personal Light Therapy System. The reason why I wanted to go over some ideas and just so everyone can understand a little bit better how to use their system. I get lots of questions, and hopefully this webinar kind of answers a lot of those questions so that it makes it a little bit more efficient to use the equipment and, of course, to achieve better results. These webinars are always recorded, and it takes about a week or two for us to edit them and then upload them onto our website. But should you miss it or want to watch it again, or a previous webinar, an archived webinar, or any future webinar that maybe you don't have a chance to listen in, just go to our website, bioflexlaser.com. At the top, you'll see support. When you hover over support, you will see archived webinars. There's a section for personal therapy like this one, and an archive for professional webinars geared more towards clinicians and our professional laser equipment, but you can watch any of them. So what I really wanted to do is we do have now a new system in our family of personal therapy systems for use at home. So I want to go over the equipment and what they do and how they're used essentially. And of course, how photobiomodulation works with respect to different issues that you might want to use it for. I'll talk about some standard safety precautions that we should all be aware of when using this type of equipment. And then I'll get into some tips about using the equipment, and hopefully this will help you with getting a little bit better results as well. And then, of course, if you have any questions, type them into the chat box as we go along. I'll get to those questions at the end of today's webinar. So we manufacture 3 different types of therapeutic light therapy systems for use at home. And they range from the P120. The 120 references 120 superluminous diodes. These are bicolor diodes, red and near infrared. P180, obviously 180, and then the mini port home, which is similar to 180, but the array, I don't know if you can see it here, is pretty much what we use in our professional grade equipment. And the software obviously is a little bit more involved with more protocols, and I'll talk about that as well too. So these are really the 3 different types of equipment that I'm referencing in today's webinar. The main mode of how this works is using a large surface array of lights. So this is an example here from the P120. And these LEDs, they're not just standard LEDs. These are superluminous diodes that make the light more like a flashlight. If you can imagine, instead of like a regular bulb where the light goes everywhere, the light's more focused and much higher intense, certainly intense, but also these diodes make contact with the skin, which is really important with respect to getting light into the tissue. That's what makes these so effective. Not to mention each diode is 2 wavelengths. First red and roughly 660 nanometers, and then near infrared, approximately 840 nanometers. The reason why these wavelengths are used is this is going back now 40 years or more now, when some of the research coming out of, actually it was out of Russia by a researcher called Tina Carew, and she established the wavelengths that are best absorbed by the targeted enzyme in mitochondria, where all of this sort of reaction takes place for light therapy that everyone sort of talks about. And it's really important that these wavelengths are used. There's a range for sure, but it's a pretty distinct range. And if these wavelengths aren't used, then you will not have the light absorbed by the targeted enzyme that you're trying to do. So that's why it's really important to understand what wavelengths you're using and what you're trying to do. The size of the arrays, they're a little bit different, right? So the P120 is smaller, has 120. This is great for treating smaller areas, or if you're of a smaller stature. P180, obviously, for treating larger areas or larger stature. And then the mini port home, which is even slightly larger as well. So, and it's slightly more powerful. So each of these arrays has larger surface area, so more tissue, more blood to treat, and also slightly more power as you go along the spectrum here. For the P120 and the P180, there's a handheld controller unit, an interface, and you can choose the 12 anatomical areas that you're interested in. So if just choose the area that is closest to what you're trying to treat. I do see some questions coming up, which is great, and I'll definitely get to those at the end of the webinar. So essentially, you're going to choose whatever protocol is closest to the area. So if I'm treating the elbow, I'll choose the elbow protocol. If I'm treating just distal to the elbow, like just a little bit closer to the hand, I'll still use the elbow one. If I'm treating around the wrist or proximal or slightly distal to the wrist, I'll use the wrist protocol. So essentially, you're going to use the protocol that makes the most amount of sense, is closest to the targeted area that you're interested in treating. The Miniport Home, it has a little bit different software. This software is basically based on our professional grade software. Similarly, you would choose different anatomical areas, just like the P120, P180, but there are more levels of stimulation. And I'm going to talk a little bit about that as well, but that really is referencing the dosaging and dosaging parameters. It gives you a wider range of parameters to try. The reason why this is important, now the P120, P180 have 4 levels, and actually our professional equipment only has 3, but in the professional equipment, you can customize an infinite number of protocols in there. With this type of software, they're static, so you get what you get. But the more levels you have, then the more flexibility you have, because people respond differently. There's many reasons for that. Everything from skin color to your metabolic rate to perhaps genetics, many factors, and we're not quite sure of all of them, but seemingly people do respond differently. So sometimes you have to fine tune these different levels to see what works best for you, right? And so the more you have, the better. And also in this particular system, there are other protocols in here, like fibromyalgia, rheumatoid arthritis, and I think there's an osteoarthritis protocol as well, specifically for those conditions. And underlying all of this is how photobiomodulation works. There's been a lot of research over the years, and I mentioned we've been around for almost 40 years. And back when our founder, Dr. Fred Kahn, got interested in light therapy, mainly because he had seen a chiropractor that was using a Russian laser device on him at that time in the mid 80s. This was pretty rare. There weren't many systems around, and they did typically come from the Eastern Bloc countries where it was a lot more popular. And it really helped his torn rotator cuff tendon. So he ended up becoming an entrepreneur in this field and started to develop them. And he worked with these leading researchers like Tina Carew. In fact, we know Tina Carew now. She's retired now and everything, but she was a researcher, Estonian Russian, and she did a lot of this groundbreaking research to understand the phenomenon of what was going on with light therapy. So as this was being developed, we had communication with her and other researchers in the UK and the United States to really figure out and understand what wavelengths should be used and the parameters. And we built on that in a clinical way. Actually, at the time, we had 2 large clinics. Now we have one main clinic in Toronto, where we've been using the equipment for 4 decades to be able to hone in with these parameters and these dosaging factors that seem to provide quite good results. Essentially, what you're looking at here is a cell, like any cell in a human body. And if it's injured, what happens is you have a depletion of ATP, which is the energy currency in your cell, and that slows down healing. And essentially, what this light therapy does is it actually speeds up the metabolism through a complex mechanism by absorption in the mitochondria. And by doing that, it triggers downstream effects in the cell. Essentially, that just means you do something to the cell, and now the cell is responding to it. So, one of the key things you need to understand about light therapy is that it's not an immediate reaction. Okay, that's not how it works. What you're trying to do is you're trying to stimulate cells to improve the metabolism to help with healing. That doesn't happen overnight. It can take days and weeks. Now, you might experience even benefit after one session, and that's not unheard of. But the goal here isn't just a temporary band-aid approach. The goal really is to help facilitate and accelerate healing, reduce inflammation naturally. That's really the main goal of this type of therapy. And as I mentioned, there's been decades and decades and decades of research that's getting better and better to elicit the mechanisms of action that I'm showing you here, and parameters that may be helpful for treating different conditions. And there's a whole myriad of conditions that can help because cells in the human body all function the same way. A neuron, a muscle, a bone cell, they're all the same with respect to the internal functioning mechanisms that I'm talking about here. And then ultimately, you're going to have a whole bunch of different effects physiologically in the cell, including improved circulation, modulating collagen formation. That's why it's used a lot in cosmetic world for helping with skin rejuvenation. And there's actual a lot of truth to that. And I'll give you a little news flash. We'll be coming out with our own beauty mask, LED mask. Probably in the next month or two. We've been working with a manufacturer on developing that, and also a hair growth cap as well. We've been working a long time on that as well, and that should be released again in about a month or 2 months or thereabouts. Also very helpful for muscle tissue regeneration and atrophy, reducing inflammation, and helping repair of nerves and cartilage and bone. So it has many different applications inside the body. So essentially how this equipment works is when you first turn it on and start to treat, you have red light, and that's roughly 660 nanometers that's being emitted. Now, red light doesn't penetrate very deeply, maybe through the epidermis and dermis areas, maybe a little bit deeper. It all depends, of course, on factors. But this is great for treating superficial tissues, it's skin, and any tissues that lie maybe a centimeter deep to the skin or thereabouts. But now this area is saturated. The light has hit the targets, which allows for the near infrared, which is then triggered right after the red light. And that the key is the timing there, because as soon as you do the red light, now you turn on the infrared light comes on automatically, and that near infrared passes through that first layer that was pre-treated by red relatively easier, which means that the depth of penetration of this near infrared, it goes much deeper. It can go several centimeters deeper into the body. It's really hard to determine the depth and the effective depth. And oftentimes manufacturers will make insane, crazy claims how deep it can go. The fact remains is that near infrared light, roughly 810, 820, 830, 840, around there goes the deepest. We know that from research, but how deep? Well, I can't say, because it depends on density, on blood flow, and the type of tissue and skin color, all these different factors. But we know it can go several centimeters, if not deeper, into the body. So that's the benefit of using the near infrared, especially after the red light. And the other thing is that cells have different number of mitochondria. The more active a cell is, the more number of mitochondria there are inside the cell. So nerve cell, muscle cells, they have a lot of mitochondria, right? Like a nerve cell has up to 2 million, whereas a muscle cell has about 2,000 per cell. So therefore, nerves are much more sensitive to light because there's a lot more mitochondria, a lot more targets for the light to be absorbed. All right. So it kind of makes sense that depending on what you're trying to target, you may want more dosage or less dosage. And that's built in and factored in to the protocols that we use. The other point I want to mention is over the decades we've been working with this type of therapy is we do understand that pulsing the light, so like flashing the light, seems to have a better effect. And now, over the years, they're starting to understand a little bit better about this mechanism of frequency or pulsing the light. And basically, I give the analogy of if you can imagine back in the days when they used steam to run a train, right? A steam engine. And they had a big fire there, right? And they were you put coal in that fire, right? That oven to drive the heat to heat up water to make into steam and to turn the wheels. What they do is they feed it with coal and then well, I don't know why I'm getting that. They're feeding it with coal and then they let the fire kind of die down a bit before adding more coal. What they don't do is stuff it so full that extra coal may in fact kind of limit the burn, right? So you want to fuel it, let it use the fuel, and then add more fuel to it. So by pulsing the light, you add that fuel, right? That light energy, and give the cell some time to use it. Hence the pulse. When you pulse, there's a dark phase. The light's on, then it's off. During that off section is when the cells are using the energy. If you overstimulate and do it too much, the effect of this therapy doesn't work, right? And you may or may not know that, but light therapy is known to have a biphasic dose response where too little energy does nothing, but too much energy also is not effective. So more is not better, less is better, provided that it's enough to create the reaction. And if that's a little confusing, it is. But end of the day, it's through experimentation and through research, we've understood what levels are required to actually get the results that you're looking for. So our equipment emits non-ionizing light. I mentioned the wavelength 660, 840. These don't pose a risk to the tissues at all. It's not ultraviolet or X-rays. They're non-ionizing. They're not going to damage the body or hurt the body in any way. In fact, from almost 2,000 human clinical trials, there have been no reported long-standing side effects of light therapy. Temporary ones like occasional headaches, transient headaches, or fatigue, or just feeling, I don't know, like kind of off a little bit or whatever. But that's temporary. We do know that there is no long-standing negative effects of light therapy. These personal systems, as I mentioned, these are specialized LEDs. They're called superluminous LEDs. Now, they don't pose a risk to the eyes per se, but they're bright and they can irritate the eyes. So if you're using it around your face, like facial rejuvenation or your jaw pain or sinuses, wear the glasses, protective glasses, because they will irritate the eyes. Again, won't damage them, but it's bright. One looks into bright light, yeah, not expecting to have their eyes look a little funny, right? Also, if you have a seizure disorder like epilepsy, that kind of thing, there are a few protocols that have flashing red light that you can visibly see. If that's the case, you want to avoid looking at that or having it around your eyes or your face. In other areas, it's fine, or you can just use a towel to cover it, but you do need to be careful. There's only a couple protocols that use that, by the way. And also, these systems should not be used directly over a growing fetus, right, or around the pelvic lumbar region, lower back region during pregnancy. Again, we don't know how it's going to interact with a growing fetus. Some people talk about photosensitive medication, but typically, like that's like Accutane or even like some natural substances like St. John's wort has been known to interact with ultraviolet light. And that's not really an issue for what we do because we use red and near infrared light, and these tend not to interact with these medications. However, I always say, hey, if you're not sure and you want to be sure, just ask a pharmacist and they'll be able to give you the profile with respect to that drug that you are taking at the same time as using the system, for example. So we do recommend talking to the doctor as well. You don't want to use it over bleeding tissues. Let it coagulate first, and then you can use it. It actually helps with wound healing. And certainly don't use it over a known area of cancer. We don't know the effects on cancer as well. Avoid putting it right over the thyroid gland. That's the Adam's apple, because the thyroid is very sensitive to light and may actually affect its metabolism. Now, this equipment is designed for adults. Can you use it for children or infants? That's your call. There are trials that use it on children and infants, but our regulatory approval is for adults. So that's what I'll stick to. You can use it over surgical implants or screws or pins or rods. That's not going to have any problem because it's not heating up the tissue. It's not a heating effect. Most of the time, I do recommend removing any creams or lotions, that kind of thing, and medications, mainly because it can kind of stick to the silicone of the pad, maybe gumming up a little bit. And also sometimes it may prevent or absorb some light as well. So just to be aware of that. And again, the light generated by this equipment, essentially is driven by electrical current, right? And so it will feel warm. So you don't want to cover up the array with a pillow or a heavy blanket because it can, make it difficult for the heat to dissipate out of that pad. So best to make sure there's an airflow or at least exposure to air when you're using that as well. And certainly don't have your cat lie on it as you're giving yourself a treatment, although they would probably love to do that. Um, and also avoid prolonged use of the personal system without time to allow the light to cool down the array. So in other words, if you use it, it's feeling kind of warm or, that kind of thing, just let it cool down for a few minutes before you use it on the next spot. Sometimes if you do too many consecutive spots, it will get quite warm and it may even set off a system error to let it cool down. Obviously, don't use it in wet conditions. It's not meant to be waterproof. Don't use it while you're driving or flying a plane or operating a jet fighter. And try not to exert excessive pressure or twisting motions on the array, as it again may damage the circuitry. That's it. Do not wrap the cables around the treatment array too tightly either. And obviously, don't open it up and try to modify it in any way. Do not use the system over the eyes. It's inappropriate as it may irritate the eyes. As I mentioned that, you want to use those dark glasses if you're using it to treat any of the upper areas around the face where you might, be looking at that light. And certainly don't use the system even as a passenger in a vehicle because the bright lights may be distracting. And of course, you might not want to leave it unattended for someone to use, in operational mode if they're not meant to be using it. And of course, keep out of reach out of children and dogs and cats and whatever other animals you have around. You can clean the device simply by using a 70% alcohol solution on a non-abrasive cloth or paper towel, or a mild disinfectant can also be used. I do recommend that you clean it regularly. Don't immerse it in water. And the straps are machine washable, so you can toss those on the washing machine if you wish, and avoid storing in extremely hot or cold environments. And try to avoid, this is really important, excessive bending of those cords and cables, especially where they attach to the array. That's where we see the fatigue and the repairs because people aren't cognizant of that and they bend them too much. It's like anything, that's where you're going to have that fatigue and perhaps the wear. I don't know why this doesn't say tip number one, but it is, or is that? Oh, that was tip number one on maintenance and cleaning. Sorry, my apologies. So tip number two is the treatment stages. It's a little bit about these is that they represent increasing dosages and pulse rate. So there are 4 stage levels within with the stage 1 being the lowest dosage and pulses, and stage 4 having the highest number of dosage and pulse rate. Okay, so the main difference between 1 and a 4 is the dosage and how fast and quick the pulses are coming out. And again, if you're always going to think, oh, well, I need the strongest, that's what's going to be the best. Not necessarily. Oftentimes I find level 1, level 2 works probably the best, although for some people it's level 3 or 4, and you won't know that really until you start at level 1. So start at level 1 and give it some time to work. For the home unit, or the mini port home, there are 6 stages, levels, with stage 1 being the lowest and stage 6 being the highest. So just more different levels. So essentially, level 4 in the mini or in the P180 is roughly equal to level 6 in the mini port home, right? So it's just kind of, they're just kind of divided up a little bit more for the mini port home system. So always start with level 1. Allow several treatments. I'm going to say roughly a couple weeks or so of treatments, deciding before you decide to move up to the next treatment stage. And essentially, you're going to do this if you feel the symptoms are slow to improve and you're thinking, well, or they were improving and now not they're improving. That's kind of what makes sense. If you're feeling good and everything's going well, then I would not really move to another stage because that's probably a good dosage for you or good parameters that are working for you. Remember, all protocols use red, then infrared. So if you see light, then you don't see light. That's normal because the infrared is invisible. If you want to see the infrared light, use your camera phone and you can see it glow kind of violet purple through your iPhone or whatever phone that you're using typically, unless there's a filter that filters it out. First, tip number 3, as far as when to change the level, again, you want to allow enough treatments to ascertain if that stage is helping. Typically, a couple of weeks, sometimes a little bit longer. Just be patient. Allow time for the tissues to heal and for inflammation to slowly resolve. This is not an injection where you're going to get an immediate hit of whatever that drug is, and then that wears off pretty quickly. This is meant to heal, right? To actually facilitate and resolve the problem, unless, of course, it's a progressive condition like arthritis, where in which case you're just trying to help with the symptoms and slow the progression down. So if you stop treating an area for a significant period of time and then you want to restart and treat again, I'd go back down to level 1. So let's say, I don't know, you're treating your knee pain, it's feeling pretty good. You're off for a few months or whatever, and then all of a sudden it starts to niggling again and you start to feel pain. Go back to level 1 if you're at like a higher level, start from the beginning. Once you've reached a plateau in the benefits at the higher stages, let's say you're at level 4 or level 6, depending on what machine you have, then actually switch it right back down to the lowest level. Sometimes that disparity in parameters can be really helpful to kind of kickstart those cells that are getting used to or accommodating to the stimulation that you're using at those higher levels. Tip number 4 is take a break. You may also take a break from treatment for several weeks and then restart back at level 1. So let's say, I don't know, you're feeling like you're getting benefits and everything's pretty good, but it's not really going anywhere after that. You feel like, I'm not making much more improvement. Just stop treatment, let the body kind of reset a little bit, and then restart. This may, in fact, help to get things going again. This may increase the sensitivity of the tissues you're treating for improved results. The other tip I want to mention is if you're treating an area, let's say you've just sprained your ankle or you have an acute injury where it feels red and swollen, right? We all know what that would feel like. Um, you can use a cold compress before light therapy treatment. The reason for that, well, number one, you think, okay, cold makes sense because it's inflamed and swollen, but the cold actually helps drive the light deeper into the tissues. So you can use that compress or the ice for about 10 or 15 minutes prior to the BIOFLEX light treatment and then apply the light treatment. You'll find, in fact, that that's very helpful for getting a little bit better treatments. And again, this has to do with the cold decreasing circulation and allowing for deeper penetration and therapeutic effects. So let's say you have an acute injury, as I've just mentioned. In some circumstances, I would recommend that you treat twice a day. So let's say you pulled your back, right? You were like out doing garden work and like now you can't move. Treat in the morning, treat in the evening, do that a few days, maybe even longer until things start to really resolve, then go down to once a day. Normally it's once a day, but in acute scenarios, if you treat like 6, 8 hours apart, I'd say that would be okay. Just you don't make a habit of doing that for just regular routine things that you're treating. I don't think that's going to really give you any added benefit. And tip number 7 revolves around treating an injured joint. So whatever joint it is you're treating, you want to treat around this entire circumference of the joint, whether that's the knee, whether that's the ankle, your wrist, your shoulder, whatever it is. If you have an internal joint problem like arthritis or what have you, it affects the entire joint, the entire synovial membrane, the entire synovial fluid. There's inflammation everywhere. So you want to tackle it all the way around the joint. So use as many arrays as possible to circle or that circumference of the joint. Of course, this may take more than just one placement. Okay, I see lots of questions here. Sorry, I see so many questions. I'm going like, wow, are you guys trying to tell me I can't hear me or something? But no, I think we're all good that way. So I'll get to all these questions very shortly. Okay, let me just get rid of that. You want to avoid treating the same area multiple times in one session. Okay, so here's an example. I'm treating my shoulder. I put the pad on this one area, and then I just treat it again and then treat it again. You don't want to do that. The equipment's designed just to use it once on that specific area, then move it to an adjacent area. A little bit of overlap is fine, but you just don't want to treat that same area multiple times because then you get too much dosage and it's not going to hurt you. You're just not going to get the benefits that you're looking for. Okay, so it's really important. It's counterintuitive. I understand that, but oftentimes less is better when it comes to light therapy. Tip number 9 is remember, light therapy has known side effects. Now, some people do notice weird things. Sometimes their symptoms are slightly aggravated temporarily. Sometimes they get a slight headache afterwards. Sometimes they feel sleepy or fatigue. That all seems to happen, but occasionally, like I'm talking less than 5% of patients or people using the equipment. These are temporary. I wouldn't worry about it. It's just not something that is problematic. So don't really pay much attention to that. And they'll typically are temporary and they should go away. We're not quite sure of the cause of this. It may be linked to its effect on the inflammatory pathway. Next, and the last tip, although I do have some bonus tips here, is that good skin contact delivers better results. So do your best to make sure that that pad is touching the skin. There's a strap that you can use to help apply pressure, and then you can buy some accessory weights or just use bean bags or whatever on different areas. Or like I say, if you have a cat or a guinea pig, train them to sit on your array just with their feet because you don't want them to lie on it because then it will warm it up. I'm just kidding. But keep pressure on the skin because it allows for light to penetrate deeper and more efficiently through the skin and into the human body. Some bonus tips. Light therapy stimulates cells and tissues that are under metabolic stress. Chronic progressive conditions like arthritis, these require ongoing treatment. If you have hypertension and you continue to have hypertension, well, you need to continue to take your drug, right? Like you don't just say, oh, I'm going to stop it now that it's under control. It's under control because you're taking the drug, right? So similarly, if you're treating arthritis, you want to keep it under control, continue to treat it. I don't say you have to treat it every day, but certainly you want to continue to treat it. If you take a break and stop treating it, well, then it's going to progressively get a little bit worse. Photobiomodulation slows the progression down of many chronic health issues. So I think it's wise to continue treatment, whatever seems to be best for you as far as the frequency goes. So even if you're feeling good, I would still, you can reduce the frequency of treatment, but I would still continue to treat. And also another bonus tip here is to understand that for whatever reasons, and they may be hereditary, we're not sure, the optimal stimulatory dosages can vary quite widely to achieve the right dosage. So you just have to play around with what may work best. And really, honestly, before you do anything, just see a healthcare professional, figure it out what you have, what you're trying to treat. And preferably, you're getting good quality healthcare to know that. Don't go on Dr. Google and try and figure something out and treat something where, in fact, it may be something that requires other types of medical treatment. And lastly, be realistic. Like, I mean, this is not a panacea. We know that it works really well. It works fantastic for most conditions. Responses do vary, but it can take some time for the effects to really kick in. And hey, let's face it, if it's taken you 50 years to get arthritis, what is it going to go away in a day or two or a week? I mean, you got to use some common sense here that your body takes time to make changes, not to mention your age and what you eat and your exercise. All of that has different effects on how light therapy is going to be effective as well. Okay, I'll get to your question shortly. My next webinar is more for on the professional side, but anyone's welcome to listen in, and that's for laser therapy for sleeping disorders. It's quite an interesting topic. I thought I'd share some of the knowledge that I know on this topic, and that's coming up on May 22nd. And you can always reach me at david@bioflexlaser.com. So let me see if I can get to these questions here. Okay, let's see the questions. Tina Carew is Tiina, so Tina with two I's, Carew, Karu, Tina Carew. The mini port doesn't have any additional attachments. And that's because it's designed for home use. You can't use a class 3B laser with it because that is a restricted device for healthcare professionals. Which of these models is closest to the BIOFLEX Dual Plus? That would be the mini port home. It's pretty much identical. Please speak about the possibility of treating underactive thyroid. Oh, wow. Okay. Yeah. So there is some research to suggest that it can be very helpful for hypothyroidism. But what I do not recommend is you just going, oh, great, I'm going to slap it on there. Look, this needs to be done. Really, it should be done by a clinician that can obviously, monitor your hormone levels and monitor everything that's going on. There are some trials out there, for sure to suggest it may be effective. But, I mean, last thing you want to do is say, hey, I think I can buy a scalpel at the local drugstore. So I guess I should be able to do my own surgery on my knee, right? Like, I know it's a little extreme, but something like a thyroid gland, and you really need to understand what's going on with the hormones. I wouldn't just slap it on there and hope for the best. So yes, it may be very helpful, and there's trials to show that it could be helpful. But I can't recommend how to use it for that unless you're a healthcare professional and you're monitoring those kinds of things. Does the mini port home allow for programming the time of a session? Yeah, so the mini port home is similar to the P120, P180. The times are static. And again, the reason for this is it's the software. Like the software we have for professional equipment is really sophisticated because it allows you to not just alter time, but the pulse rate and what's called the duty cycle. There's other factors you can change on that. It gets quite complex, and we really can't factor that into the mini port home. So it comes standard with the treatment times recommended. You can play around with that with respect to, if you want to increase the time, you can just start another treatment, right? There's different ways of getting around that. For the P120, assume that the only difference between each of the four levels is essentially the length of treatment time, the wavelength of red, infrared remains the same. For all the equipment, all the wavelengths are the same. The differences are nuances in the protocols correct with respect to not so much time, but duty cycle and frequency for these different models. What parameter works best for skin? If you're treating just skin, red works best, but I still think infrared has a good role to play. But if you had just to choose one, it would be red because that's what's targeting skin. I have a home unit connection problem. Like any issues with the equipment or whatever, I'm not your guy. I'm the clinical guy. We have a service department that can definitely help you out there. How would you use this for sinuses? I've done a webinar on sinuses. So go to bioflexlaser.com, go to support, go to personal archive webinars, and then you'll see one for sinuses. Someone talked about Hashimoto's. Hashimoto's is hypothyroidism. I just commented on that. I get an error when I turn the unit on, then shut it off. Again, anything like that, maybe the software needs to be looked at or the unit or whatever. The service department can help you out there. Is it dangerous to start at level 4? If you start at level 4 and not level 1, I am pretty sure that will cause the Earth to spin, counter spin opposite, and will spiral to our death. No, just kidding. It's not dangerous, but yeah, I don't recommend it for the reasons I think I already outlined earlier, is you want to start with the lowest levels and see how you respond. It's intuitive, counterintuitive to think less is more, but for this, it may in fact be that less is more. So start at 1, please. Are these tips shared when you purchase a device? Well, I mean, I'm sharing them now. So, I mean, we have a manual and we have all these webinars I do. So that's kind of what you get. I would assume, I mean, we have a full manual with equipment, if that's what the question is. And a lot of this was from the manual, by the way. I would assume that some people do not experience any improvement even after using your device for a while. Well, I mean, like here's the thing, right? It depends what you're treating or what you're trying to accomplish. It's true that not everyone will respond optimally. That is to have a desired effect that they're looking for. For some people, they're looking for things that are unrealistic. Like if you have, if I'll just give you an example. If you have a shoulder impingement syndrome because of frayed and torn rotator cuff tendons and you're 65 and you expect that to heal completely with light therapy, no, I mean, that's not going to happen. But if you have a torn muscle, this will help it heal completely 100% much faster than the norm. It really depends what you're trying to deal with. But there are some people that don't respond as well as others. There's no doubt about that. In general, when you look at human clinical trials, they're for the most part very positive. That is, statistically, it shows that it was helpful for most of the people in those studies. Fibromyalgia is a tough one, and I have done a webinar on fibromyalgia. There's so many factors there. I say that overall it is helpful, but if you do have fibromyalgia, you'll know that there's many factors at play there. But I think this is a nice, non-invasive way of helping to reduce inflammation and helping with muscle pain and fibromyalgia. I was always told to skip a day and not use consecutive days on the same spot. Okay, so the recommendation for using the equipment in general is if you're treating a condition like a chronic condition, treat it every other day, maybe 3 days a week, maybe 4 days a week. I'm not saying treat every day. In acute scenarios, I would say treat every day. You just have a fresh injury. Yeah, treat every day for maybe 5 days, 6 days, 7 days, and then start to go every other day. That's typically what we do in the clinic as well. But you can add an extra treatment here or there. I just wouldn't use it every day of the week forever because the body accommodates a little bit to it. So I hope that answers your question. Does it work on bone knee joint? Yeah. So bone on bone just basically means the hyaline cartilage is completely gone. And now, of course, there's very little separating the bones. It's not going to regrow cartilage. Obviously, it's not going to have any, crazy effect that way. But I have seen it really improve symptoms of bone on bone. Ultimately, on a knee, that you'd be looking at a knee joint replacement. If you're like absolutely not a candidate for it, or you don't want to do a knee joint replacement, I recommend a couple of things. One is a rebound brace. They're expensive, like $2,000 or so. But as soon as you weight bear, the weight's displaced off the joint surfaces in that compartment in your knee joint, and that's really helpful. And the other is light therapy that will also be very beneficial for reducing inflammation. So it can be very helpful, and I've seen good results in bone on bone, but we're not. It's bone on bone. How much time to wait between sessions? I think I've covered that. Can I use it over mold in my gut? Can it kill mold? No, it's not fungicidal with respect to mold, mycotoxins. Um, I mean, it's not going to have a direct effect on an infection. It's not used for any kinds of infections, but secondary symptoms to mold or some other viruses or whatever, whether it's inflammation, those kinds of things, and the immune system, it may be helpful. So, and it may help boost the immune system, which then helps with these infections indirectly. Someone with MS or Alzheimer's, can they benefit from? Yeah. The question is about multiple sclerosis and Alzheimer's. There's now a lot of research being done into these fields for neurodegenerative diseases, and we're seeing really good results. Not one doctor ever told me about the system, knows anything about it, so I can't get any info from them. Well, Sherry, if you talk to 99% of doctors out there, they are trained with what? With pharmaceuticals, surgery, and referrals to physiotherapy. Typically, that's their realm. I'm not saying that's negative. I'm saying that's what they're aware of. They're not necessarily aware of this is used in the rehabilitation realm, so it would be unusual. But I can tell you this that some doctors are really well aware of light therapy. Ask hair replacement surgeons; they know about red light therapy. Ask dermatologists; they know about red light therapy. Ask orthopedic surgeons; they know about red light therapy. It's just that your average family physician oftentimes that's not what they're, that's not their thing, right? So they don't know about it. Uh, okay, lots of questions. That's good. The nano adhesives irritate my face. Yeah. Um, yeah, I know sometimes adhesives like that, they can irritate it. You're just gonna have to there are straps, by the way, you can buy for the nano, or you can just hold it. It's not a long treatment time, like it's just a few minutes so for your face or whatever. So you should be okay with that. Um, my chiro started me on red light therapy. Awesome. I hope your chiro uses our equipment. I've been using 120 units since 2019 and 180 since 2020. They're awesome, and it's once able to do it's nice to be able to do two areas at the same time. Thanks, Andrea. I do appreciate that positive feedback. Your check is in the mail. Just kidding. BioFlex therapy should be available in every therapist's office. This device has kept my family in one piece for years. That's awesome. Oh, that would be so nice for our company if it was available in every clinic. We're a low-key Canadian company. We're trying to improve our exposure out there on social media. In fact, recently we've just signed up with a bunch of influencers. Jen Salter, Salter, Jen, Jen on Instagram and TikTok. She has like 3.4 million followers or something. She's using our equipment. We just signed a contract with TNA Wrestling. And they're starting to promote our equipment as well. And the Rams just re-signed for 3 years with our equipment. Can you read the lupus question? Oh, lupus. I didn't see the lupus question. Sorry. Uh, so if it boosts immune system in a person that has lupus, we are not to use the products that boost because it is already overactive. So it can cause, say, stress for the body or increase flare-ups. Um, okay, here's what I would say to that question. So the effects of light therapy tend to be kind of like localized. I mean, yeah, it's systemic in that it's going to go in the blood, but like something like lupus, we were talking like a whole body systemic effect. So I'm not going to, I would not say that light therapy is going to have a prolonged effect on the immune system and the entire body, which then may impact something like lupus. I'm talking more about the general localized area that you're treating. I don't think that's really a problem. Again, because the effects of something like a red light therapy, it's sort of a temporary effect to get things going in that area, as opposed to taking a drug or having another effect on the immune system where it's longer lasting. I just don't think it's a major problem. Are all the past seminars available? Yeah, all of these webinars are available on bioflexlaser.com. Go to support and click on the archived webinars. Yeah, Louise, these are expensive devices because we make them in Canada, and everything's hand assembled and made here. So you can imagine that by the time we do everything and we make the molds, we do everything. We have an assembly plant. So, it's kind of expensive. I do get that, but the equipment does last for a long time. And if you factor a few $1,000s over 10 years, it's not so expensive. I mean, it is and it isn't, if you know what I mean. Okay, thanks very much, everyone. I do appreciate you listening in, and hopefully we'll see you next time. Bye now.